Hi, everyone. I'm Dr. Jess Calohan, and I'm chair of the Psychiatric-Mental Health Nurse Practitioner Department at Frontier Nursing University. Today, I'm going to be talking about self-care strategies during crisis situations. I think we would all agree that the current COVID-19 pandemic meets the criteria for a crisis situation. The reaction that people are having to this situation is a 100% normal reaction to a very abnormal and unprecedented situation. Stress is very common in these situations. Stress is there to serve us as a protective factor. However, when stress becomes prolonged, people can start to have emotional, psychological, and physiological symptoms. Some very common psychological symptoms are fear and worry. And the fear and worry is really uh, based on the fear of the unknown, not knowing what's going to happen, not knowing if somebody's going to get sick, not knowing if their family members are going to get sick, not knowing what work looks like, not knowing how they are going to meet their bills and their other obligations. And so you can kind of see that worry goes on and on and on in this particular situation. Stress can also cause physiological symptoms. Usually when people are having a prolonged stress reaction, sleep disturbance is one of the most common symptoms and one of the earliest symptoms that occurs. The sleep is disrupted because people are having a hard time shutting their mind down. Those of you that have had some insomnia in the past related to stress, whether that was an exam, whether that was a work deadline, whether that was a conflict with somebody, or whatever it was, it's not uncommon for people to think about those things and worry about those things, and their mind doesn't shut off and they don't get good rest. In this particular case, we're talking about a prolonged reaction of fear and worry that's dominating every aspect of a person's life, and they get to the point where they lay down and their mind just goes and goes and goes and goes about all of the things that they're worried about. People that lose sleep, that has a significant impact on their day-to-day level of functioning, whether that's physiological functioning, cognitive functioning, emotional functioning, social functioning. And it can actually worsen the fear and anxiety and any other types of symptoms related to the stress that they may be having. So it's a vicious cycle where people are having fear and worry, and then they don't sleep, and then the sleep just makes it worse, and then all these other symptoms start to crop up. Increased or decreased appetite. There's some people who are emotional eaters and tend to eat more and maybe gain some weight during this stressful experience or situation. Other people don't eat at all, and they're not providing their body with the nutrition that it needs. This can also result in irritability, being short with others, low frustration threshold, being irritable with significant others, family, coworkers, all of those sorts of things. Decreased energy is also a common symptom where people just feel emotionally and physically exhausted because of the time that they're spending worrying and managing the stressful situation. And then prolonged stress, so stress that is lasting for more than just a few days or a few weeks, can actually decrease our immunity. And in this particular case, immunity is a very important thing for us. And then people can fall back into maladaptive coping mechanisms, things like increased alcohol use, increased use of nicotine or other psychoactive substances. And all of these things just perpetuate the stress reaction. So what are some things that we can do to manage our stress reaction? First and foremost, you have to focus on what you can control. When we start thinking about the unknown and the fear of the unknown, what does that look like? It's really about a loss of control because we don't know what's going to happen, and we don't know how things are going to end up. And so we have to take a step back, and we have to really reestablish some control over our lives. And how we do that is focusing on the things that we can control. Stay in the here and now, meaning stay in the day-to-day function. For some people, the way that they get through this is they live, they plan hour to hour and moment to moment, and they stay focused on the here and now because that decreases the amount of worry about the fear of what's going to happen or the unknown again, and it helps people reestablish control. It's really important to maintain your daily routines as much as possible. Staying in our daily routines with our meeting our basic needs, food, water, sleep, work, exercise, as much of those things as we can maintain a daily routine, that will help decrease the amount of stress. And it provides an outlet for you to get rid of some of that fear and worry and manage that fear and worry. The other thing is to limit the daily time spent on social media and following the news in this particular situation. Those of you that have personal email inboxes probably have gotten so many COVID-19 updates, and everywhere we look, it's COVID-19 this, COVID-19 that. And what that does is that never allows us to kind of take a step back and say, let's get a break from COVID-19 for a second, because it just puts it in our face over and over and over again. So what I recommend is that you limit your social media and following of the news, and try to prioritize where you're getting your information and what's really important about this particular situation. First and foremost, getting updates about the situation, closures, and those sorts of things is absolutely essential. And then also supporting each other and being connected on social media is helpful. But when we start to continuously have this stuff in our face, it begins to over-pathologize the situation, and essentially re-traumatizes us and re-exposes us on a frequent basis to what's happening. And I'm not suggesting that we ignore what's happening, because that's not at all what I'm saying. What I'm saying is that if we set limits for ourselves to say, hey, you know what, here's a few social media things I'm going to do today, and here's a few other outlets that I'm going to get information from, and I'm going to do that for a set time a day, then you really allow yourself to fall into a routine without being distracted by all of this other stuff, or noise, as I like to call it. Make time for yourself, very important. That goes back to maintaining your daily routines. If you're somebody who exercises on a daily basis, and you enjoy going for hikes or walks or whatever it is that you do, make sure that you're taking some time for yourself every single day. Also, have regular touch points with your coworkers, especially if you're not used to working from home. I've heard some suggestions about virtual coffee breaks, virtual lunches, etc. Those are different strategies that you can use to stay connected with your coworkers, and obviously with your family as well. We have a lot of media or platforms that we can utilize, FaceTime and some of those things, to still keep in touch with those that are important to us and those that are critical in our support systems. And then, and that kind of leads into redefining your plan for how you leverage your support network, because it is much more challenging to go to somebody's house, or go visit them, or drive 400 or 500 miles to see somebody. So what is your plan for leveraging your support network, and how is that going to be accomplished? These are all things that will help you manage the stress and reestablish control over maybe some of the fear and worry that, quite frankly, all of us are experiencing to some degree. So some of my final thoughts here. You are not alone. Everybody is in this situation together, and you have support networks that are available. This is a 100% normal reaction to a very abnormal situation. Now, I will say this. If you are doing these self-care strategies and you notice that your symptoms are starting to get worse, you're having more significant anxiety, that is fear and worry or depression or anything like that, and it seems to be persisting and not getting better, in other words, it's getting worse instead of getting better, then I would encourage you to reach out to your healthcare provider for assistance. Reaching out to healthcare providers as it relates to mental health issues are help-seeking behaviors that, quite frankly, are an opportunity for self-improvement and not a sign of weakness. We all struggle at different points in our lives, and we all need different levels of support and help. And these help-seeking behaviors will help put you back on the road to hopefully some more emotional and psychological peace. I'd like to share just a couple of resources with you. The crisis text line is a national text line that you can get information about worry about COVID-19. You can talk about stress reactions, and you can actually have a text conversation with a mental health professional. Of course, if things are very difficult and you know someone or you yourself are struggling significantly with this situation, depression, those sorts of things, then the suicide prevention hotline is definitely a resource. People sometimes confuse the suicide prevention hotline with, I have to be suicidal. Really, the suicide prevention hotline is also a crisis hotline. And so if people are in crisis, it's there to help assist them manage that crisis. There are multiple apps for stress management that you can download. There are many apps that help you with a different variety of strategies. And all you have to do is just Google apps for stress management, and they'll pop up the top 10 apps that people use for stress management. And then you can select the one that may be most appropriate for you. Remember, we are all in this together, and we need to make sure that we're leveraging our support systems. Thank you very much for your time today. And I hope this presentation was informative.